Hello, and welcome to the CE Planning Activity File Completion Information Session. We're helping nurses work with nurse planners to navigate the TNA TNF Provider Unit ANCC NCPD CE Activity File Template. Tips and tricks will be provided throughout the session. By the end of the session, 90% of participants will be able to identify the required components of the TNA TNF NCPD activity file template and describe the process for documenting professional practice gaps and associated educational needs. So why do activity files matter? The American Nurses Credentialing Center, ANCC, sets the national standards for nursing continuing professional development, NCPD. The Texas Nurses Association Foundation, or TNA-TNF, serves as an approved provider under these standards in the state of Texas. Completing the CE paperwork accurately is essential because it ensures that contact hours awarded meet the national requirements and protect both the learner and the provider. Incomplete or inaccurate files can delay approval, disqualify CE activities, and negatively impact the accreditation status. So we're going to begin at the very top of the template, activity, title, date, and type. The form has fillable content boxes throughout the form. The date the form is completed must be before the activity. The TNA/TNF provider is unable to provide any CE hours for activities that have already been presented. Let's talk about the difference between provider-directed provider-paced versus provider-directed learner-paced. What is the difference? The first, provider-directed provider-paced, is used for live in-person or live virtual activities, in-person such as the annual conference, or live virtual such as Nurse Talks. The second, provider-directed learner-paced, is used for on-demand learning courses that a learner can complete on their own time. For example, TNA-TNF Provider Unit released 2 learning modules on AI during the 2025 Nurses Week celebration that learners can add and complete at their convenience. The nurse planner will work with you at the beginning of the process to ensure the correct activity type is selected. The requirement for this section is to complete a brief description of the problem or opportunity for improvement that your activity is designed to address the learner's need. Think about it. What is the problem or opportunity that needs to be addressed by this activity? This can be a one-sentence response that includes what the specific problem or opportunity is. Best practice is to have one concise sentence defining the professional practice gap and one corresponding concise sentence for the opportunity for improvement. Tip and trick. Although it's not required to include the target audience in the professional practice gap statement, it is important to consider the target audience when investigating the problem or opportunity and determining the gap. This helps to ensure the gap is specific to the problem or opportunity the education is targeting. Take a moment to reflect on your topic. What gaps have you encountered that education could solve? Evidence to validate the gap. In this section, the purpose is to provide a summary that includes the nurse planner and planning team's analysis of the data, not just data sources. Things to think about. How is the evidence informing you that a professional practice gap exists for your target audience? What data supports the need for this educational activity? The evidence statement should include the nurse planner and planning team's analysis of the data, not just data sources. Stating that there is a need or a request for the activity is not an adequate response. Examples of types of evidence to support the professional practice gap can be used to validate the needs for the activity. Survey data from stakeholders, target audience members, subject matter experts, input from stakeholders such as learners, managers, subject matter experts, evidence from quality studies and/or performance improvement activities, all identify opportunities for improvement. Evaluation from previous education activities can also inform and validate the evidence of the gap. as well as trends in literature or direct observation. So what is the educational need that underlies the professional practice gap, which will fall into one of three categories: knowledge, skill, and/or practice? It is important to note that the underlying educational need should align with the professional practice gap. This can be a simple one-word response of knowledge, skill, or practice, but should be supported by the professional practice gap and the evidence to support the professional practice gap and desired learning outcomes. Tip: reflecting on these questions will guide the nurse planner and planning team to choose the applicable underlying needs. Why do learners need this education? Is the professional practice gap related to what they do not know? Knowledge. Is the professional practice gap related to what they do not know how to do? Skill. Is the professional practice gap related to what they do not know how to apply or implement into practice? Practice. And you can check all that apply. The majority of the underlying educational need for TNA continuing education is a professional practice gap in knowledge. Gaps in skills and practice are not as common because the association doesn't have the bandwidth or capabilities for the return demonstrations that would be required for skills or monitoring practices that change over time. Identifying and describing the target audience is important and must include the registered nurse. So think about who needs this education. Analyzing the professional practice gap and the evidence to support that professional practice gap should help to determine the target audience. As always, the target audience must include RNs, registered nurses, but can include other members of the healthcare team as listed here. Learning outcomes may be the most challenging as it is important to differentiate between learning outcomes and learning objectives. ANCC NCPD accreditation requirements requires learning outcomes. When considering desired learning outcomes, the statement needs to be written in measurable terms and should include the outcome and the metric that the outcome is measured by. The learning outcome must tie back to the professional practice gap and the underlying educational need. If the underlying need is knowledge, the outcome should be related to measuring a change in the learner's knowledge. The measurable learning outcome is not a list of objectives. Tip: when reflecting on the following questions, they will help guide the nurse planner and planning team to choose applicable learning outcomes. What is the measurable goal or outcome this activity sets out to achieve? What should the learners know, show, and/or be able to do at the end of the activity, which identifies the underlying educational need? What will be measured when the learner completes the activity? Describing the evaluation method. In this section, you'll explain how you will collect evidence to show change in knowledge, skills, and/or practices of target audience members at the end of the activity. Tips: the evaluation method chosen should align with the educational needs identified and the expected learning outcomes that have been identified. The chosen evaluation methods should be measuring the success or expected results related to the identified learning outcomes and where the underlying education need exists. A formal evaluation form is not required in this section. The description of the evaluation method should discuss how the evaluation data is obtained and analyzed and should clearly describe the data being collected. For example, do not simply state that an evaluation form will be completed. Go into detail on what types of questions are being asked on the evaluation form. The TNA TNF provider unit focuses on short-term evaluation. Short-term evaluation options include a self-report of learners' intent to change practice, active participation in learning activities, a post-test, which will help evaluate knowledge-based gaps, a return demonstration when a skill is simulated or practiced if it is observed in their practice, case study analysis, role play. Long-term evaluation options are generally not used with TNA and TNF provider unit education, as the provider does not have access to things like self-reported changes over a period of time and changes in quality outcomes, retention data, patient safety, observation of performance at the point of practice. Remember, the evaluation method must align with the identified learning outcomes. Evidence-based content and references. This section has two parts: the description of the evidence-based content that will be provided during the learning activity and supporting references. The description of evidence-based content can be presented in various formats, such as a table or an outline or an itemized agenda or in a narrative format. Please note that for continuing education activities 6 hours or longer, an itemized agenda must be provided in addition to the description of the evidence-based content. The supporting resources should include the best available evidence that appropriately supports the outcome of the educational activity. Best practices is for references and resources that have been developed and or published within the last 5 to 7 years. Examples of supporting evidence-based references include information from organization or websites which use current available evidence within the last 5 to 7 years as a resource for readers, such as the Agency for Healthcare Research and Quality, the Centers for Disease Control, the National Institutes of Health. Information available through peer-reviewed journals or resources. These journal articles should be within the past 5 to 7 years unless the seminal work of the original author. Clinical guidelines, expert resources such as an individual, an organization, an institution, book, article, or website, and a textbook reference. Learner engagement strategies. Learner engagement strategies must be congruent with the activity format and the underlying educational need that was identified, knowledge, skill, or practice. The learner engagement strategies can be provided in an educational activity table, a list, or in a narrative format. Learner engagement strategies should be developed by the nurse planner and planning team in collaboration with speakers and content experts. Strategies should be realistic for the activity type. Note, this section is about learner engagement, not teaching methods. Engagement is an ANCC NCPD requirement. Examples of learner engagement strategies are integrating opportunities for dialogue or question and answer, including time for self-check or reflection or discussion groups, analyzing case studies or peer review, think, pair, share, or providing opportunities for problem-based learning. When providing a list of individuals on the planning team, clearly identify who is the nurse planner and who is the content expert. In the case of TNA TNF provider unit, the nurse planner is the Director of Nursing Professional Development. The primary presenter is usually identified as the content expert. However, the planning team may have a specific identified person serving as a content expert reviewer, and in this case would be listed as the content expert. Please provide the credentials of all planners and team members along with the names. A planning team must consist of a minimum of 2 individuals. Nurse planner responsibilities. As the TNA Director of Nursing Professional Development serves as the nurse planner for continuing educational activities, there are specific requirements in the process that they will complete. These include calculating the number of contact hours to be awarded. This is done by determining the number of minutes dedicated to learning divided by 60 and rounded to the nearest quarter hour. They determine the criteria for awarding contact hours. The most common criteria are attendance for the duration of the activity and completion of the online evaluation. Creating and documenting the certificate of completion. This is completed through the association's learning management system. And documenting the standards for integrity and independent standards are reviewed by the nurse planner. This includes mitigating relevant financial relationships. And finally, by providing a disclosure statement to be included in the activity when it is presented. Evaluation post-presentation. All continuing education activities must have an evaluation post-presentation. The TNA TNF provider unit requires the planning team to arrange a meeting 30 days after the offering. The nurse planner will send a meeting invite for the agreed upon meeting date to all members of the planning team. This summative evaluation has two pieces that must be addressed. The first is a summary of the data, highlighting whether the activity was effective in closing or narrowing the gap and achieving the educational activity outcome. The analysis must provide what was learned by the planning team and what can be applied to future activities. Tips. The summative evaluation does not simply include the data collected from the evaluations. There should be a clear analysis of the data from the nurse planner and planning team documented. There is no prescribed method for providing the summative evaluation information. Common delivery methods include a narrative format, SBAR, SOAP note, or table with analysis information. Prior to sending the activity file to the nurse planner, please review the following content areas. Professional practice gaps are supported in the evidence. This is why education is needed and must be validated. Outcomes are specific and measurable. Remember, outcomes are not objectives, and that all planning teams' credentials are listed. The completed activity file must be submitted no later than 4 weeks prior to the date of the continuing educational activity. The nurse planner needs sufficient time to review the activity file and provide feedback to ensure ANCC NCPD compliance with the activity file. It's important to reach out early and often. If specific sections are challenging, contact the nurse planner and email them clarifying questions and any developed content for review and feedback. Thank you for listening to this informational session. We hope that you found it valuable to completing the activity file paperwork. We look forward to collaborating with you on future CED activities.